Okay, President Trump and the White House are looking to reassure the public about the severity of the president's COVID-19 infection, but his treatment regimen is painting a different picture. Yahoo Finance's healthcare reporter Anjalee Khemlani is here with the details. Anjalee, well, the president tweet stormed this morning here. What does it say about his health, and what is the administration saying right now?
Right. So let's start with what we know about what he was treated with. To begin with, we know first off, he was given that antibody cocktail that has not been approved in any format from Regeneron. And then we went on to hear that he was also being given Gilead's remdesivir, which is one of those EUA authorized treatments that has been used more broadly in the public. And then also, most lately, dexamethasone. And that's the one that's causing the most concern among health experts, because that is something that's typically given to more serious patients based on their oxygen saturation levels. As of right now, we know that Trump has done a number of things to sort of enforce a view of strength and the fact that he is still healthy. He's provided a video on Twitter, 4-minute long video, talking about how he feels, thanking his team. In addition, we know he did the drive-by yesterday from the hospital. And we've heard from his physicians that he is doing well and recovering well. But there's questions as well, because we know that the president's physician also mentioned that they were trying to keep the tone upbeat. So listen to what Yahoo medical contributor Dr. Derek Cass said earlier about similar issues.
We don't know enough about the president's condition to know anything about whether he should be in the hospital or released. We know that when he was admitted, the information being given to us was they were admitting him out of a quote unquote abundance of caution. The idea being, as the president of the United States, that we need to take extra special care of making sure that he didn't quote unquote decompensate in the White House, and they were prepared to take care of him. There's no course of disease that is completed with this coronavirus in 4 days. And so it's surprising to a lot of us that given the number of medications he's received, the conflicting evidence about his vital signs, that they would now stop being cautious and be frivolous with his care by bringing him back to the White House and not actually seeing him through what is the very concerning second phase of this disease, which happens only beginning probably day 6 through day 10 or 12. Remembering also that patients that are hospitalized have prolonged courses, not the mild or asymptomatic courses we expect to see, which would be less than 10 days.
You can hear, there is concern about what we're being told, the American public, from the White House and the physician team versus what we can infer from some of the responses to questions.
Anjalee, you've been covering the situation with COVID so closely from day one here for us. This regimen that the president has gotten, all these different medications, is that the normal regimen that COVID-19 patients receive?
In part. So the cocktail antibody from Regeneron, again, going back to the fact that it's still in clinical trials, is not available to the general public. The other two are, and in fact, are part of sort of the standard protocol. But it also depends on the level of seriousness. These are drugs that have been, in fact, given to more serious patients when there is more concern, sorry, about the timeline of the illness. So as it stands, that's sort of where most of the focus is on, is what is the president being given, why, and sorry, more transparency on that.
Anjalee Khemlani, thanks so much.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.